First of all, I have to apologize that I changed my subtitle. So now it's users first, from harm reduction and rehabilitation to care and good life. And my argument here is that we need to think more profoundly about drug policies and the goal of treatment, for example. It cannot be harm reduction or rehabilitation. It has to be something more, providing people, users, people who use drugs, abilities and opportunities for better life, and also provide them with good care. Before I begin, I would like to thank the organizers for arranging this important conference and also giving me a possibility to share my views. I come from Finland, and where I have followed and worked with drug policy issues since the turn of the millennium, so almost 20 years now. My my background is in research. I have conducted several studies, ethnographic studies on especially harm reduction interventions, needle and syringe exchange, and opioid maintenance treatment, and also thresholds of services among the most vulnerable clients living and spending their time on the streets. And this investigation has led me to my argument. Why do we need to reform our drug policies? First of all, current policies have failed, I think, quite dramatically to produce a positive position for drug users in a society. And this has led to a significant, what I call, lack of care and empathy among users, and especially among users who suffer from the most serious problems. My first slide was from a Harm Reduction International Conference from Canada. It was arranged a couple of years ago, 2017, sorry. And I was impressed by what I called activism of the users there. They were really angry. Canadian Health Minister Jane Philpott gave a speech there, and the users were very angry towards policies in Canada at that time. They felt that their need weren't heard or addressed in policies, and they had this almost in every kind of a pause or break, they had these kind of demonstrations where they held signs. This was one of the slogans. They talk, we die. So they are talking about politics, who talk about drug policies but don't do enough. The other slogan that was very often used was life won't wait. So we cannot kind of talk and talk forever. We have to do something in order to change policies and people's lives. So I was really impressed by that. So why do we need to reform our policies? There is this lack of empathy and care. American anthropologist Philippe Bourgeois talks about useless suffering of drug users and homeless addicts, which is caused by society's institutions that should actually provide help to these people. And this suffering is useless because it could be prevented even by very simple methods, by providing enough services, evidence-based treatment, as we have heard here, and also some kind of an attitude toward kind of a caring and empathetic attitude. So this picture is also from the conference. It's a grieving family who had lost their daughter to opioid overdose. Jared Zigon is an American anthropologist as well, and he has discussed about what already Paul Larson discussed earlier today, that war on drug is actually war against people. And besides actual overdose deaths, it produces social deaths, which means that people who use drugs are seen as somehow incapable of living a normal life and lack any qualities which define a normal person. And these quotes are from Zigon's book. We talk about less than a human, evil addict, dehumanization of addicts. Shortly about Finnish policy. In Finland, we have so-called two-tracks drug policy at the moment. This is a definition of Finnish researcher Tuukka Tammi. And this means that we have two tracks, public health and treatment and criminal control, which go their own direction but do not communicate with each other. And this is something that causes still a lot of problems, especially in the field of treatment. Because, like my last kind of a point here, because the criminal control is so powerful still, it is shown in the moralistic attitudes among public authorities and even social and healthcare professionals working in the treatment field. And also there in the treatment field, there is also this tension that many still hold that people should be completely free of drugs before they can participate in a society. So these tensions this is caused by this two tracks drug policy, and at the moment there is discussion, what should we do? Many researcher, developer, public official is arguing nowadays more and more that we should have, like in Norway, that we should concentrate on the health and all the policy options should strive towards better health of users. Street level view. I spent last spring this 2019, a couple of months on the streets following this kind of what do you call it, outreach work team, which works with people who live and spend their time on the streets. And this is what I've found or noticed. Many users do not receive enough support and proper help, even in the treatment service system. This has led to a vast distrust towards social and healthcare professionals and public authorities. People don't trust the services, they don't want to go there, and they feel that they are looking down upon there. And there is also, on the other hand, feelings of constant control, that I'm constantly supervised, I'm being tested all the time, I have to give that test in order to kind of show that I'm doing well, or various kind of measuring all the time. On the other hand, they feel like they are neglected, that people, the professionals who work with me, they really don't want to hear what I actually feel, they don't have time. And this has led to feelings of shame, loneliness, and what I call emptiness. And this is quite a good, one person described himself to me like this: I'm actually more a monkey than a human being. So, and this is just one example, but this was kind of many people said the same thing, perhaps a bit different words, with different words. So, my questions are, why is it so difficult and in some cases even unthinkable to apply new and alternative ways to deal with drug addiction? And have we overlooked some important issues regarding drug users' health and well-being and their maintenance because of this, and contributed actually to their degradation? I strongly believe that current institutions cause a lot of problems that drug using people face today. So why is it so difficult to apply new methods? Australian researcher Robin Room has discussed addiction narrative as a form of horror storytelling. It's kind of a story when one first goes to poorhouse and then to the grave. So downwards, nothing positive. It's just going against the grave. In this process, one loses one's humanity, and addicted people are usually seen in these stories as people who don't have any kind of a capacity for kind of a positive feelings or caring and so forth. And the only way to recover is confession. I have to confess that I am an addict, that I have done wrong. So this is one reason why is it so hard to reform policies, because the view of addicted people is so kind of narrow. Helen Keane says the same thing. She's also from Australia, and she holds that addiction discourses are engaged in the production of truths about drugs and drug addicts, drug users. And they have maintained these discourses, maintain policies and identities that have been damaging to users, such as denying, I think this is very important, such as denying them as addicted individuals a possibility for autonomous agency and proper subjectivity. So these two things, that addiction is something that, constantly, if person is addicted, he or she cannot do hardly anything else or have any kind of other emotions besides this addiction and craving. And also that, they don't have any kind of agency anymore. The addiction has kind of captured them. However, based on my research, I strongly view that we should think this through. And what I'm suggesting, this is kind of a policy statement based on my research, that we should have this kind of a users first drug policy, which is about caring and emancipating drug users. This kind of policy would take as its starting point drug users' basic and human rights. So they are citizens of the countries, and they should have their rights looked after. I worked in substance ombudsman activity in Finland, where we kind of help people finding treatment and kind of protect their rights to treatment. And I have to say that many of these rights are violated all the time. People don't get treatment even though they should be entitled to it. And I think this is a very strong, how do you say? I'm losing words in English, but this is a very negative issue, of course. So what drug policies should do is protect these rights, first of all. What drug policies should also do is cultivate users' potentials and give them possibilities for participation and looking their own position in a society. So not just being object of drug policies, but really the subject. Like, what do you want? What is your goal in life? Can we help you? Drug policies should also give users possibility to look after themselves despite they are using. And this is, of course, what is done in the harm reduction field at the moment. But I think that the measure should be even more kind of ambitious. What is very important is that actions, whatever we do, they should diminish the feeling of shame, loneliness, and emptiness, which is quite kind of, like I showed, prominent among drug users these days still. So few central concepts. Care. Care is usually something that is perhaps associated with babies or old people, but I think that care is something that we all need, and it should be provided also to drug users. So care is something that where a person is taken as who she is, and activities are sensitive to this need. And they are flexible, interactive. They really want to communicate with the person who is object of care or subject of care. So another central concept is community. A community is a place or places where people would be able to realize their goals and potentials. And I think that especially what I'm talking about Finland now, we don't have these kind of places at the moment. We have some day centers where people can go, but they are very hectic places, and they don't provide this kind of a place where you can be at home, in a sense. So care of the self, this is a more maybe a philosophical concept. It's a concept of French philosopher Michel Foucault. But care of the self means that we should have activities that provide people with information and tools look after themselves. And what is essential in this care of the self, it's a practical form of practical ethics, and it aims to a life where a person can shape oneself and his or her life with the help of other people, not by himself or herself, but with the help of other people. So we should have more these kind of practices where we really are doing together something in order to reform policies, but also people's lives. American aesthetician, sorry about the pronunciation, Richard Shusterman has this concept of somaesthetics. And for him, a good life is kind of something that he takes one's body as a starting point for good life. So when we talk about drug treatment or therapy, we usually are focused on the mind, like we should transform our minds. But actually, Shusterman sees that if we start to look after our body and we are giving tools to look after our body, this is kind of one possibility for a kind of a good life and, as he says, virtuous and right action. So just a couple of examples. I interviewed people in harm reduction, needle and syringe exchange facility, and how they felt what has been helping them. So first of all, this is a woman in her 30s. I interviewed her a couple of years ago, and she said that the discussion goes always like drug injecting is a death sentence, and that person will use drugs forever. Some people do live on the streets and have a lot of problems for sure, but many also have homes and, you know, we watch television and all. Here in the needle and syringe exchange service, I get information which I can really use in my own everyday life. Yeah. And this is a man who was in his 40s when he started to visit the facility. And he said that there is no use in controlling and forcing a person to do something if he hates, for example, authorities. And then he explained how he got, you know, help from the needle exchange facility. First, I came here once, and you know, and I started to exchange needles and syringes. Then I started to talk to some of the workers about the educational leaflets that were available here in the facility and commenting on them. You know, how they depicted drug use, etc. Then I got interested in peer work, and here I am now a chair of the user organization. So it was a process where he was he was able to take part to these activities in his own pace. That was really important to him because he really hated different kinds of authorities. So what I suggest, how to move forward in drug policies, these are not very concrete, but first of all, we should experiment more and look for profoundly new ways of thinking treatment and help. Secondly, we should create institutional structures that support this. So we really should think about how services are organized, what kind of facilities they are, where do they where they are situated. And lastly, we should really support drug users in their own initiatives and communities and kind of stand at their side, or how do you say it? But yeah, thank you.